Fingers. Anyway, that's my problem, not yours. Right, we'll move on to the next part of our meeting, which is the reports on the committee meetings, and we'll start with Janet's committee, quality and safety.
Thank you, Mark.
Thank you, Janet.
I'll report on the committee, and then I think either Natalie or John will present the actual quality report. So just obviously, I assume people have read it. I'll just pick a key item. Key items. We'd already covered the discussion about the risk register earlier, and as you will recall, quality and safety is the committee which is overseeing the progress of the CQC action plan and improvement plan. We had been having extraordinary committee meetings in between our bi-monthly committees. We had an also workforce committee, but we took the decision at this meeting in January that we would actually incorporate this into future committee meetings. We felt that would work perfectly well, and so we cancelled the proposed extraordinary meeting, which was going to be held in February. Other items that I wanted to pick out were particularly around the quality account priorities. We had an initial discussion about that, just to actually, I suppose, start to focus our thinking on what those priorities should be for 24-25. And you'll see that we actually had the discussion around the fact that we needed to ensure that these were coherent or synergistic or even synchronistic, to use the sort of the word that we were talking about earlier, with the work that's ongoing, particularly around the CQC improvement plan and the patient safety incident response framework, which is obviously being implemented at the moment. So the plan is that Tori is leading on this work, and she will go back and consult further about what those priorities should be. They will come back to the March Quality and Safety Committee, and then we will be in a position to make a recommendation to the March board on which priorities we should actually be pursuing for 24-25. I want to just pick out one other item for a report, which was around the medicines management update. We'd had some concerns at a previous meeting around the processes following for actually looking at controlled drugs. Board will know that those are actually very proscribed, and we needed to be assured that we were actually following those, so that we were following safe process. The report that we had actually provided a great deal of assurance. You'll see we gave it level 5. The one item that is ongoing is around the fact that you need Home Office licenses for actually having controlled drugs not on a hospital setting, and that we were aware that this wasn't actually being followed for the dental and the sexual health services. I have to say, as an aside, I think that this is, from my perspective as a dental person, I don't think any trust is actually following this, and I think that actually we've highlighted an issue which probably other trusts will now be pursuing. So CPAG have obviously looked at that and monitored the issue of risk to patients of not carrying out the activities that we're carrying out using those controlled drugs against actually waiting to get the licenses, and the decision has been taken to carry on providing those services, but at the same time seek those licenses so that we can ensure that we're doing things in a safe manner, but also our patients aren't missing out by having to stop services that we were hitherto providing in a perfectly safe and reasonable manner. I think that was all I wanted to pick out from the discussion. Obviously, you've got the other assurance levels there that we also discussed. A number of those, quite a lot of them, are actually linked to the summary quality report, which Natalie will just cover following my report. So that's all I wanted to say. Thank you, Chair. Happy to take any questions.
Thank you, Janet. Any questions at all? No, I have one, and I'm not sure who's going to answer. I'm sort of disappointed with the performance of our response to complaints within the time frames. Your report states that it's the annual percentage rate is around 43.5. I'm looking for, and you say it's improving. I'd like some assurance around that how that is improving, and also if that is that a rolling percentage. So it might be 43.5 for the last 12 months, but it could easily be sort of 60% now, or indeed 20% now. So I'm just looking for some richness around that statistic and our performance there, whether that's Janet or Natalie, I'm not sure.
I think that's probably within the quality report. So that's something which we have discussed in the committee at previous meetings, and also this one. I know there's work ongoing. Natalie, do you want to pick that up?
Yeah, happy to, Janet. And yeah, we absolutely reported through to Quality and Safety that we had concerns about our response times had dramatically reduced. So we have done a complete and full review of all systems and processes relating to complaints, and a benchmarking ourselves against other organisations. So we're reworking the whole process from the receiving of a complaint to the end point. So that has taken some time. We are starting to see some improvements, but also the team has really struggled with some absences over a couple of months, which has had a significant impact on their ability to meet those response times. Some of the key issues we're doing around how we work with each SDU to engage them in the complaints process, because that's fundamental to how you respond in a really timely manner. So we are seeing a gradual increase in improvements, but it is still a concern that we're monitoring through QNS.
Thank you, Natalie. And if you want to carry on with what you were going to say with regard to your quality safety report.
Yeah, so I'll just I'll pick out a couple of highlights, I think, for me. One is that people will have noted that the reported incidents had a spike, according to our SPC charts, and when we did a deeper dive into that information, it was clearly linked to an increased reporting of self-harm incidents related to a small number of patients reporting very high levels of incidents. So we wrapped around and made sure that that was being appropriately managed, which it is absolutely. The Mortality Oversight Group has met for the first time. This is bringing together a number of previous groups so that we get richer learning and thematic learning across mortality. So I'll be looking forward to reporting back to board some of the progress that group's making and some learning against those themes. We've talked about the controlled drugs, which is a key, and then I'd like to touch on patient experience and what we're currently doing. So as people will know, Friends and Family Test is well utilised in parts of our organisation, but not so much in others. So together with Sue's team, we have care opinions being rolled out and tested in a number of our teams across the trust, which is a way we engage differently with getting patient engagement and patient stories and responding to those. And we've also had an on-site advocacy project at Hillcrest. This is part of the how are we monitoring it more closely. They did a 3-month trial that's just ended and have given us some really rich feedback around the benefits of having advocacy regularly in wards that's not related to Mental Health or Mental Capacity Act. And so we're now looking to see how we can expand that to our other acute mental health wards. And they were the key points really that I wanted to draw board's attention to this month.
Thank you, Natalie. Now, you've been frozen on my screen for the last three or 4 minutes. I don't know if it's the same for everybody else or it's just me. I got some nods around. So once we finish your report, please don't disappear yet. I was going to suggest you'd have to go in and out as I did. Oh, you're back. You're back moving. You're back moving. Good to see you. And I believe I was the same previously, which I was unaware of. But, thank you, Natalie. Sarah.
Just a question about the mortality and learning from deaths, because it's really disappointing that's a level 1 given all the work we've done. And I know the committee's being restructured, but it was just some assurance. Has it actually happened yet? Because there was reference to November being cancelled, which I presume means there hasn't been a meeting for 3 or 4 months. So just some assurance that's back on track now, because it's a really key item, isn't it?
Yeah, so they met for the first time last week, and the launch in November did have to be cancelled, unfortunately, but first meeting happened last week. Lots of positive feedback. It is going to take some time to make sure we are clear about how those groups are embedding. There's a really strong patient voice in that group as well, so they're really well embedded. So yeah, first meeting last week.
Okay, and to bring to people's attention, if you're not watching the chat, and very often I can't, that Trustpilot for for patient opinion, care opinion, I think you called it, will be demoed to non-executive directors when we next get together. I think that's already been organised. Thank you. Okay, if there's nothing else, we'll move on to Workforce Committee. Tessa, Elaine.
Thank you. As Janet said, we had an extraordinary Workforce Committee in December, and then the January meeting where we agreed that we didn't need an extraordinary meeting in February. The improvement plan work has been going very well. I think a couple of things to highlight. A really good piece of work that's been done by Scott and Charlie Windsor to align the recovery plans, and I think probably 10 of them at the last count, back into the improvement plan, so we're not duplicating work. So that was positive. I'll leave the targets issues for Elaine to pull out in her report. We've already talked about the Arise programme this morning. Just to note that we are pushing forward on the menopause friendly employer application, and Kate Lees is hopeful to get that done in the next 2 or 3 months. I think the most important thing to say to board is that we had a meeting outside of the committee to do a workforce committee reset, where we've looked at the work plan, the agendas, the terms of reference and membership, and are going to have an overhaul of that. The workings of that will come to March Workforce Committee for agreement, and then it will be embedded from April going forward. And then just to say that the behaviour for all policy was approved. Happy to take questions.
Thank you, Tessa. Any questions at all from anybody, or should we move on to Elaine? Elaine, please.
Thank you, Mark. If I pick up some of the specifics around targets, our sickness targets and appraisal targets still remain below average, but this is being picked up through the SDU integrated governance meetings, and a requisite action plan or recovery plan is developed out of that. We continue to have stay conversations with staff around attraction and, more about retention. And that is including exploring the potential to work flexibly. We are going to be doing, and I think this was referenced earlier, a review of our employee relations cases, and this is a report that will be brought back to Board and Workforce Committee in March. We've referenced the Arise programme, and so I don't want to repeat that, but related to that is the work we're doing around rolling out our people strategy. We approved in principle the leadership behaviours framework last week. This is an integral part of the improvement plan, and we're looking to integrate all of the, as Tessa has already mentioned, the recovery plans into the improvement plan, specifically around our work to increase representation of women, staff from underrepresented groups, the way in which we handle bullying and harassment as well. And then work we're doing with staff to support staff. We've mentioned menopause. We have a number of initiatives in trust around working with neurodiversity. Those are going very well. But it does relate to probably an earlier board meeting where we had one of our own staff members talk about the additional support that we can offer to staff that we employ. We've mentioned the EDI strategy already, so I'm not going to repeat that, but I'm happy to pick up any additional questions. My only additional thing I would add is, as colleagues know, the National Staff Survey is closed. We did have a 1% increase in returns from staff. Early indicators are there are some small movements, but we expect a little more detail towards the end of February, beginning of March, where we will look at what our response is going to be from a trust perspective. I don't know if there are any specific questions that arise from colleagues from the report that's attached.
Any questions at all, colleagues? No, just one point I was going to make, if I could, Elaine, is with regard to appraisals. And the whole area of managing workforce, when there's not enough workforce and there's too much work, that's the foundation of much of these things, is extremely difficult. But I noticed there seems to be the reason appraisal hasn't been done is because of clinical demand, I think is broadly the that might be a reason, but it's certainly not an excuse not to get appraisals done. They're a fundamental right of our staff. It's about our staff well-being, looking after our staff, and I think we need to impress this on our managers that in terms of our cultural change that we're going through, it's part of getting the culture right is to reference and recognise the work of staff and encourage them and support them, and that is done not only through appraisals, obviously, but it's an area that I would like to think that we could make the appraisal part of that, and thereby get our rates better.
Yeah.
Matthew, I don't know if you wanted to comment on that.
Yeah, absolutely. So we monitor appraisal rates through the integrated governance meetings which we have with each SDU monthly. Where appraisal rates aren't up to the trust standard, SDUs are on improvement plans, and these are monitored also monthly. So this month we've seen special mental health and learning disabilities actually achieve their overall appraisal rates.
Thank you, Matthew. And now you've frozen as well. Vina, did that answer the question, or
that answered my question? Thank you.
Okay, thank you very much indeed. Tessa.
Just a plea really that whilst we absolutely need to drive up the rate of appraisal, one of the other things that came out of last year's staff survey, and I doubt would be any different this year, is the quality of the appraisals. And so we must make sure that as we do all the improvement work, we're looking at the quality of the appraisals that people have.
Yeah, and just following that up very quickly, Tessa, colleagues will know that we've refreshed the My One-to-One approach. The intention is we make it as simple as possible with some key prompts for line managers. I mean, the devil is in the detail and the quality of the conversation, but we're trying to make it as accessible as possible. So we've relaunched the paperwork.
Okay, thank you. If there's nothing else on that, if we can accept and note that report, please, and then we move on to F&P. And in the
sorry,
absence
Mark.
Sorry, Jill, go on.
We just need to approve the behaviours for all document. It come from Workforce Committee with a recommendation for approval.
My apologies. It's had its tyres kicked, and I think it's been sent out separately as well to board members. Do we all agree that behaviours for all document? Yeah, agreed. Thank you, Jill, for keeping me on track. F&P, Biraj is unfortunately unavailable today, so I think it is Tessa that's going to introduce Biraj's report. Thank you, Tessa.
Yeah, thank you, Chair. Just a few things to pull out, and then I'm sure Robert can pull out any further detail if necessary. But just to say, 3 new recovery plans were approved. The EPR recommended supplier is now at the stage where it's subject to full business case, and that's proceeding smoothly. There were 2 key assurance reports in respect of strategy delivery for digital and the green plans, both which are making good progress, and they're both on the board agenda. I don't think there was anything else specifically. The risks were reviewed in detail, and I think at that point I'll hand over to Robert for his input.
Thanks, Tessa. Mark, I guess it's questions, and then I'll move to the reports.
Any questions on that at all? Okay, and Robert, I'm not sure where you'd pick this up, because whether it could be in workforce, it could be in F&P, or it could be in your finance report. But I suspect you're going to say something about it anyway. But could you make reference to our agency spend and how we're doing and trajectories on that? And that's linked to again the regional meeting I went to, whether increase in staff, so more staff you know, you'd have been part of the meetings, more staff, less productivity, more use of agency, etc. I'd just like you somewhere in your reports today to comment on where we are as a trust on all those things. I think I know the answers, but I think it'd be useful for you to explain. So if there's no questions on that, over to Robert.
Yeah, thanks, Mark. I'll pick that up under the finance report if that's okay, just to mark people's cards. So if we pick up the performance reports first of all, and again, I suppose I'll just start with there's a clear link back to the report that Tess has just drawn out. So we did have several recovery plans. There was three quite important ones which have been approved. Clearly, it's a little bit of a moving picture at the moment. You'll all have noted and be aware that one of those is around talking therapies, and we're just waiting to see how the guidance is, as we understand it, going to change for that. Matthew and team are all over that one, so we will update. I've got a feeling Matthew's frozen as well. So that's going to be important, but a couple of other really important ones which we think are going to feature as priorities as well. Out of area placements, which is has been a long-standing topic. We're historically pretty good at this one, but even we're experiencing pressures, so we've got a recovery plan around what we're doing there. And again, Matthew and team are putting a lot of time and effort into that one. And then there's picking up the theme around children's, young people. We've got access targets that you'll all recall, the new access targets coming in this year, which is really good. It's putting some visibility into the service, but it's obviously challenging us around complying with that. That one, just to say, there's a known kind of technical issue around some activity that we can't record at the moment. That's linked into our support teams in schools. So there's something that's been progressed there is on a regional level. Notwithstanding that, we clearly need concerted effort to kind of focus on how we improve overall access and rates there. So that's that part. I was going to draw out Sarah's comment earlier from her report. You'll all remember we had the quarterly review and the segmentation. That stands at 2 at the moment. Although we've got CQC report that's imminent, and then that'll be reflected through in our March Q4 update. So that's probably going to be the one of the main areas that we'll need to look at in coming meetings. I think the rest of the elements in the performance report, there's quite a lot there, but I'll pause there, Mark, and take any particular questions.
Any questions? I don't think there is. Although we all know it, it's very stark within our metrics, the people metrics, isn't it? You know, it screams red at us when you look at those. And I know there's activities going on to address them, but it's very stark when all collated and brought together. And when we look at those, we can only deduce that we're not doing good enough for our staff, basically. And I know there's a lot of focus going on to address that. If there's nothing else, if we can accept the performance integrated performance dashboard and performance report and the F&P committee report. Thank you very much, and we move then on to audit committee. Now Martin's unable to be with us today.
Mark, sorry,
yes.
I just need to pick up the finance report, and I'll pick up the agency part in that one.
Ah, you did, yes, indeed. Sorry, you've got a double entry there, which I've missed. My apologies. I'm not doing very well, am I? Robert, where you go, finance.
I'll take it that was a very subtle reference to accountancy with double entry there, Mark, which I'll do a nod for.
I'm well versed in accountancy, as you know, Robert. Yeah. Not.
Yeah. What I want to do is a couple of bits. I'll pick up the report. I'll focus on the agency, but I did want to just make a few comments around the planning as we're leading into next year. So there's some relevant bits there. Just because we haven't got a particularly good spot elsewhere. So those are 3 bits. Just in terms of the finance report then and where we are, this is month 8. Clearly, as we know, we've gone through a system reset and resubmission with our plan being reconfirmed and staying as we were with our overall underlying break even that we're trying to achieve, and then a stretched contribution to support the system. Overall, things are very tight and pressured. We're aware of a number of the pressures that are out there and have been there for this year, so I'll just remind folk excess inflation, so that's the inflationary cost pressures over and above what was planned for back in the allocations from kind of 12-18 months back. Obviously more localised and ongoing issues such as industrial action and the like are putting pressures into the NHS as a whole, and they're all very real from a how do we deal with that from a financial perspective. In terms of our own plan, we remain on track, and that's largely down to two elements that we've been working through. We did have a comprehensive efficiency plan at the start of the year, which obviously cut across all of the organisation, both from a kind of a corporate and back office services, as well as technical things we were doing, and then clearly elements for frontline. That's actually progressing well, and we are on track to deliver that, which is a huge achievement, and clearly a really important part about how we maintain our sustainability going forward. The agency spend I'll come to in a moment, that was one key aspect of that. We have been making good progress. I did just want to draw out capital, which remains a significant element of work for this year. Again, that has remained on track. We've got a number of schemes that are happening towards the end of the year, particularly around in Worcestershire, the Section 136 suite and the Hadley works on the PICU, which are all progressing well. As we know, the largest scheme we have ongoing at the moment is the dormitory work, which is now just concluding on the Hereford aspects at Stonebow, which will take us through into late summer next year. But that remains pressured but on track. In terms of agency, we have made good progress this year, although we are likely to fall slightly short of the stretch target we set for ourselves. So again, just as a reminder, we were seeking to bring our agency down to 13 million this year, which was a significant reduction from the 19 million we had last year. Looking at where we're likely to outturn, we've just revised our forecast outturn, which we're putting in with the month 9 returns. We think we'll outturn at around about 14.5 million, although we're still striving to do slightly better than that. That is a good progress and reduction. I think when we take into account all the pressures we've had around that, it certainly is good progress. Clearly, where we are now, we think a lot of that has come from us looking at our management controls and appropriateness. Some good work from Matthew and team, Rob, particularly Natty and her team, around looking at the escalation processes we have around that. We really need to start hopefully seeing some of the fruits of the Arise programme as we go into next year and beyond, because we need to fill those vacancies. That's essentially where we go. So there'll be a lot of focus on that. Matthew would no doubt say, as the SRO for the programme around that, we've got a workshop coming up in a couple of weeks where we're going to talk about that as a broader leadership team around how we focus on that form part of the planning. That leads me into the planning part and just looking ahead. Just on agency, the national target for agency has been reduced again next year, so it's down to 3.2% from 3.7%. We're clearly comfortably in excess of that. We'll outturn around about 6.5%, and then we'll need to be looking at our plans to draw that down for next year. In terms of planning for next year, the guidance isn't out. There is a lot of work that's going on in the background as a system, clearly particularly focusing on exit run rates for organisations this year, and then how we draw that together as a plan in very constrained circumstances for next year. That at the moment is going to mean quite a bit of work to draw together for our March Trust Board, where we will be aiming to bring our budgets through, and the intention is to do a session with board in the development part in February to kind of run through all of that. So there's a lot of work in progress with that, Mark. Just a couple of key headlines I will draw out, though. It does appear that our underlying exit run rate due to excess inflation and the like is not at break even at the moment. We are somewhere around about 3 million adrift of that underlying position. So that's part of the challenge we take into next year. Clearly, we need to understand how all the system allocations and funding and priorities work through. But just to let you know that that's where we are with all of that.
Thank you, Robert. Questions? Sue?
Sorry, just at that moment, my computer started doing something silly. I've got 2 questions. One is about debtors. So 4.4 million, some over 90 months. Is that normal? And what sort of people owe us money? And the second question is about agency staff and whether or not we're using e-rostering, and whether or not in appraisals people are asked whether they feel that their manager does manage the rotas well.
Yeah, on the debtors, it's yes. So it's over 90 days, so not 90 months. I think you probably just misspoke on that one. I would be worried if it was 90 months, I have to say. Overall, no. I think if you look at our the overall turnover of the trust and the balances we have, we do focus on this through F&P, and actually it's something that external audit comment on. Probably you need to look at a couple of things together there. The BPPC, it's something I mentioned quite a lot. Actually, we are paying our invoices that we should do over 95%. The over 90 days ones, it'll be a combination. Sometimes quite a bit of that might be NHS organisations predominantly, and it's probably where there's a particular query or something that's part of that that's just being queried, which tends to cause a slight delay. So we have some fairly big numbers that move between the system, and there's sometimes bits we just need to clarify. So I think the number is appropriate in line with our turnover. And as I said, if you looked at the BPPC, actually we have a really good record of paying our dues in time with that. So it's not something I would be thinking we have cause concern at the moment. In terms of the agency and e-rostering, I might draw Natalie in a moment. E-rostering is a really important tool. It's something that I think as we move forward over the next 12 months, we'll probably look to use more to help us get that forward planning around how rosters look. Sorry, Natalie, I'm talking. I'll let you come in.
Thanks, Robert. Yeah, so absolutely we use e-rostering for a large majority, not all of our services, but certainly all of our inpatients and our 24-hour services and lots of our things like our neighbourhood teams. What we've recently had approved in December was a new e-rostering policy that talks about what good e-rostering looks like. So we've introduced a suite of roster metrics, which is part of, satisfaction as well, but that's the starting point to make sure that we are rostering effectively and building on that, including absolutely how staff feel they're being rostered, or looking at pilots for things like self-rostering, which we know again have really good results in other areas. So it's using our rostering more effectively at the moment that's key.
Thank you, Natalie. Thank you, Sue. You done, Robert? Okay.
Yeah, all done.
Couple of points I was going to make. Firstly, it's not every trust that looks at a set of papers, finance papers that look like this. And that's because of the rigor that Sarah and the executives apply to the organisation in maintaining our budget. So well done to all on that, and also obviously well done to Robert for keeping tight control of it. The only other thing I was going to mention is very often in the discourse about agency spend, excessive agency spend is immediately linked to deficit budgets. It's worth remembering that, yes, our agency spend is more than we want it to be, and that I think, and I hope Natalie nods, will give us a quality issue potentially. But actually, because of the manner in which all of you may manage the budget, it's not giving us an overspend issue. And that is something that is often missed in a lot of conversations. Yes, we have possibly $1 million to $2 million outside of our target by year end, although Robert says he's looking to reduce that, but that's not affecting our potential outturn on our budgets, which look like they're going to come in as per forecast because of the tight management that Robert and the team do. So thank you very much for that, Robert. And we look forward to the February session when we're going to be discussing what we're going to do about next year. As you've already indicated, run rate or underlying is potentially 3 million short, and that's before I know you'll get on to the excess inflation in the system and other pressures. So it's going to be quite challenging discussions in February as to how we're going to maintain our status as bringing our budget in line online every year. Thank you very much, Robert. If we could now move on then to, if we could note that and then move on to audit committee meeting, which was held in December. And Janet is going to talk us through this one in Martin's absence. Janet.
Yeah, thank you, Mark. I'm going to cop out actually and say that I think this is a very full report on the committee meeting. You can see that we have reports from our external auditors and also our internal auditors, as well as the other reports that come to the committee. As I say, I think this is a full description. So I'm sure everybody's read it, and if there are any questions, I'm sure that Robert will answer them very happily. But the one point I did want to make was just linking back to what we talked about earlier around agency spend, just to say that actually we have quizzed our external auditors, because obviously they carry out audits in other organisations similar to ourselves, and one of our priorities is obviously around reducing agency spend, and so I've certainly asked them on a number of occasions, what are other organisations doing and can we learn from them? And the response they have given us on several occasions is actually, we are doing as well, if not better, than other organisations, and really they struggle to think of anything we can learn from them. So I think that's actually a bit of, I think that's quite a useful insight to feed into the discussion that we've just had. But as far as the committee meeting goes, I'm happy for Robert to answer any questions on it. Thank you.
Any questions for Robert on the audit committee December? No, in which case we can note that and move to charitable funds. So.
Okay, just a few sentences on this. The first thing is we approved the annual report. The second is, you may notice there's a line that we've had some disappointing returns, which was explained to us as being because we don't invest in oil revenues. But as you can see, the investors thought we were well positioned to make improvements. Very pleasing that we got some money from the NHS Charities Together charity, which you may see advertised on television sometimes, which can be used for the Evesham Physio Courtyard refurb, which has to be done within a timescale and with a report going to NHS Charities. We had a very interesting discussion on someone's PhD application, where we were able to define what we thought was good use of the money or not, which was basically related to how much it helps the trust as well as helping an individual. And just notice that we talked a bit about governance costs, and there'll be more about that in the next meeting. But in particular, we are spending money on someone to look at expenditure in Malvern, where we have some money that we need to disperse. And that's what I think is necessary. Robert might nod or shake his head if I've missed something out.
It seems you got a thumbs up from Robert, which is always a good thing, Sue. And thank you very much for taking on the committee as well, the chair of that committee. If there are no questions, can we note that report and then move on to the mental health collab and Carol?
Yes, thank you. I think we're still holding the record for the shortest reports, which I welcome. I must say that it is, I personally find the committee slightly frustrating. It's about collaboration. We've got a different format that we're setting up. It's the first committee of its type. Therefore, things are moving a little bit slowly, and everything that we agree also has to be agreed by the ICB board. Putting all of that aside, I think we had a really useful meeting last time with the right people around the table, and we were starting to talk about the terms of reference, which we hope we will be able to bring back to you in March, with them also having a big agreed around that time by the ICB board. And I think the only other point I would make is about the risks. That I think it's worth saying that at the moment all the service risks are being managed within the partner organisations, and the work that we're trying to do is really to bring out what are the risks around that system, rather than repeating what's being done at the service level. Sue, was there anything you wanted to add?
No, Carol, I think, as you say, it's a reset, an opportunity now to really strengthen those joint arrangements over the next 12 months.
Yeah, thank you.
And just to remind us, so we're going to run the committee like this for 12 months. Is it then going to be revisited in 12 months' time around delegations and all those sort of things that was originally the plan?
that's likely to be what we include in the terms of reference. It'll be probably 12 months from when those are agreed rather than and when they kick in, which, I mean, if we can get everything in place for April, as in terms of the new terms of reference, rather than all the other arrangements, I would expect that we'll have a look at them a year after that.
Okay, thank you very much indeed. If we could all note that. Oh, Sarah.
Sorry, I don't know if I missed it when Carol was saying, but just wanted to highlight the issue around LDA, learning disability and autism. So the mental health executive, which is obviously a subcommittee of the committee, subgroup of the committee, focuses obviously on a range of mental health pathways, the mental health investment standard, etc. There is a suggestion, because you'll recall as a board that we were originally talking about delegation of LDA into the collaborative ultimately, but there's been a suggestion that LDA comes within the scope of this committee, so it becomes the mental health and LDA collaborative committee, but that underneath there's an LDA subgroup as well as the mental health exec subgroup. So it's quite a fundamental shift for what the committee's covering in terms of scope. Sorry, Carol, I might have missed you saying it, but I just wanted to draw that out because that is quite a change. So the proposal is to, and it's being worked up at the moment, I've asked for a more formal proposal to come to both the committee and the board to explain what does that mean. Because when we first discussed it, obviously there were bigger risks around delegation, particularly around the financial costs of some of the placements. But obviously it's different without the delegated function. But just to let you know that that's a key issue that being discussed within the whole conversation about the collaborative.
Yeah, thanks, Sarah. No, I mean, there's a sentence in the report there, but I think certainly as soon as we've got more information, we'll bring it back. And because it's when you just hear it's described like that, it's quite complicated and quite difficult to picture. So I think it'd be really helpful to bring it back when we've got more clarity around it for that discussion.
It would be really useful. And also, if the description from Sarah, it's pleasing to see that LDA is going to have a separate committee reporting in as well, because we don't want LDA to be lost within the greater morass of the difficulties around mental health. So that's a useful thing. Okay, well we'll look forward to seeing that come through and the development of it, Carol. We know it's a ship that's sailing and being built at the same time, which is never the easiest thing to do. But I know you and the team and the committee will do so. Okay, thank you very much. We can now move on to a couple of update reviews on the Green Plan and the ICT. So first of all, we come to the Green Plan and Robert.
Thank you, Mark. Yeah, so Tessa referred earlier that this strategy review went through F&P earlier in the month, and obviously it comes onto board for annual review. Just a few points for me to draw out. So first of all, just in terms of a reminder about the overall strategy, this is a national requirement from the NHSE that all organisations have a green plan, and this is to help us have a visible roadmap to achieve the NHS commitment to achieve net zero by 2040, and then as set out on page 235 of Diligent, we have some intermediate targets that we're working to as ambitions around Scope 1 and Scope 2 and 3 emissions for later this decade and into the early 2030s. Just a reminder, Scope 1 emissions, those are the ones that are directly related to what we do. Scope 2 is around some electricity and like, and then Scope 3 is that much longer, broader supply chain and the likes, where we use things, travel and all that sort of stuff. So there was also just worth drawing out, the NHS set out its plan around this a couple of years ago, and even with the recent announcements from the government around changing some of the targets, most notably kind of the elements around low emission vehicles and internal combustion engine cars and the like, the NHS targets and ambitions haven't changed. The vehicle we have, just to remind everyone as well, we were asked to produce a 3-year strategy, which we did as a trust board, and that's what we're working to. A little bit unusual, it was 3 years, and that does draw out one of the points I've got later in here, which is that through the next financial year, we will be looking at our green plan for the coming period, because that's actually the end of that 3-year period. I think it's likely we'll probably just be extending what we've got because we did a very comprehensive piece of work, but that's part of what we'll go through. So then just looking back at where we were, what you'll see is we actually had a very packed year. Clearly, it's always a challenge keeping the green agenda and keeping the priorities there whilst we have all the other things we're juggling, but we've made some really good progress this year. And I guess if you picked out the elements on the exec summary, what you'll see is there is actually an awful lot of policy that's going on here, as well as some very practical things. And what we've managed to do is we've managed to work through quite a basket of measures that cut across both, operational delivery, as well as some of our corporate and back office services. So we've got things around going paperless on pay slips. We've got things around the estate and the environment. We've got things around biodiversity in there, and travel and the like, and all of those elements. So there's an awful lot that's going on. It's probably one of those ones as well that's worth drawing out that we've got some really passionate members of the trust that are involved in this. So the Champions Network has actually been really quite successful, and we're getting more input from that. We've got some ideas that are coming up from the ground. So we've had an initiative around people turning off, switching off machines when they go home and so forth, and that kind of came up from the ground. So what I'd say is you've got a lot of detail in the report. I'm more than happy to pick up any specific questions. F&P had a good run round of this and assured that we're making good progress, but noting this is a huge challenge for everyone, and keeping it live within the context of all the other challenges is clearly going to be an ongoing challenge. But I'll hand back to you, Mark, at that point.
Thank you, Robert. Anybody got any questions on our Green Plan strategy and implementation? Sarah?
Just a quick one about the champions, really, because I know that was sort of almost evolved, didn't it, rather than being a deliberate strategy to seek champions, and people came forward showing an interest, which is fantastic. So I was just wondering what support they needed, whether we needed to do anything else to enable them to really play an active role.
I think we're doing okay, actually, Sarah. What the bit we do is we link them in quite strongly with some of the comms that we do around that, but it's probably one of those ones because it's generally been people generally self-selecting who've got an interest. We've actually had quite a lot of interest, and that they are taking quite a lot of ownership. The bit we're having to work on is the comms around what we've got, and sharing through all the different things we're doing in different areas and how they work through. But so far, certainly the last year, that's been working pretty well.
Thank you, Robert. And I think, as you pointed out, this is something that is going on very much behind the scenes, and in such an important agenda that we have across the whole piece. It's difficult to see it on occasions, but it's pleasing to see this report come forward and demonstrate that regardless of the pressures that are on everybody, it's still going ahead, because I think, as you've indicated, staff get this, understand this, and want to do everything we can to address it. So thank you for bringing it back to us, and thank you to the people that are actually driving this ahead. Okay, and I think if we can note that, and then I think in some ways it does link to our next one, which is ICT strategy. So Lisa, how are we doing?
Thanks, Mark. So the report presented to the board today has been through F&P, Finance Performance Committee, and the assurance level of 5 was gained from that review. A few key points to point out to the board. The actions within the report demonstrate progress against the plan that is set out within the strategy. We know there's more to do. Digital never stops, so we will continue to build on that as we move into the next year. The few things really to point out is that significant progress has been made on a number of the areas set out that is within our control. There's some slippage in ICS-led strategies, predominantly through funding within the ICS and changes in personnel, which we are picking up as ongoing conversations. We have some really good new contracts in place for the provisions of various elements of digital, namely in networks, that will provide us some really good enhancements in those areas. And some some significant achievements around Cyber Essentials Plus, DSPT, and as Sarah mentioned earlier, the Service Desk Institute accreditation. We've also done some learning from the Care Notes outage, which hindered us in achieving some significant work over that period, and that learning has led us to the implementation of a robust backup system that will help us continue working should that happen again, although we're hoping with some other areas that we've improved that shouldn't happen again. We've also had some significant achievements in the implementation of the electronic prescribing and medications administration system, which has been really successful and adopted really well across the organisation. It's really positive feedback from those users that have started to use that system within community inpatients, and we have now gone live with our first all in mental health inpatients, and again that has been a really successful go live within those areas as well. And as of this week, we are now also live with bed management and patient flow system in some areas. So we've got some keen, enthusiastic users started to use that to see how that can help us flow patients through the system. So again, really good news in going live with those two big systems that have been in the pipeline for some time. And those really are the key things to point out. There's still a lot to do, as we've said, and we're hoping that the achievements we've made in those two systems and the enthusiasm that's raised amongst ourselves will actually increase our digital push. The next focus really for us is the implementation of the EPR system that is starting now, and we've got some good digital clinical leaders to help us push that system through over the next year, and obviously continue with the keeping the lights on and making sure that everybody is supported well from the in-house team.
Anybody got any questions on that? Janet?
Yes, thank you, Lisa. This is really impressive and really encouraging. And I agree about the EPA having been out the senior instruction, and the enthusiasm of the staff is amazing. Particularly from some teams that actually, historically maybe haven't been that positively linked with IT. I haven't put that lightly. But it's really interesting to see how it's going. Really impressive. My question is a completely different question though, and it's about going forward and actually now. You hear, when you're in the NHS, you hear people talking about how difficult it is to recruit and retain good IT professionals within the NHS, because we have to pay them with an agenda for change, and that obviously they can keep working in the private sector. It sounds to me as though you've got a really good team around you, which is a credit to your leadership, I think. But what's your feeling about recruitment and your team? And are there any risks there that we should be aware of?
Recruitment is difficult. I mean, we have struggled to attract. The nice thing about I believe particularly within this organisation, because it's a whole in-house team, is that we can start staff on the service desk as apprentices, and we can encourage apprenticeships to the service desk, and they learn their trade as they go through. And yes, we may then get to a high tech role, but actually we're bringing the next generation along with us as we do that. So we can encourage lots of people to join us in that way. We haven't yet. That is on our agenda for the next year. We want to be in a really good place as a team before we started encouraging apprenticeships. But we certainly have had a flow of promotions through the teams as people have moved through in different areas. So we've seen people flow through the team. So that's really encouraging. We do end up losing them, but actually we do grow them as well as we go.
Thank you, Janet. I think I know an example of that, Lisa. A couple of points I was going to raise, if I may. You mentioned very briefly the lights on. I presume that is a reference to making sure our basics of connectivity for our staff, the thing that really frustrates staff are they not being connected or taking too long to connect and all that. So as impressive, and they are, all the initiatives you're doing, one of the key things is to actually keep those basics there, so staff on time, work, and all the basic stuff works. As long as our finger on that possible as well.
Absolutely. We've just started on our third clinic. So we're going out about with meeting staff and we're understanding what the issues are. If they've got anywhere in particular that they've got issues, and understanding how we can help them with those issues. As I said, the new contract I think will help because it will increase the bandwidth in other areas.
Thank you. And the other one, I'm looking for some assurance. I don't think through the list of the projects or the themes, sorry. But digitally connecting patients is the one that you've given us the least assurance. It's still a 4. Yeah, that's done in isn't it? Our sort of how the system which is to try and let shift our patients and digitally enable patients and stuff. But could you give us some assurance around that theme, Lisa, about how we're trying to get that motivated a bit more, please?
Yeah, so we had the patient portal. I have helped on the patient portal within the organisation some time. The struggle we have with that is because it's got multiple organisations and multiple teams within those organisations inputting into the development of that. So we never really get to the end of development. So it's an ICS-led project. The ICS have had some national funding, but that's more towards elective care. So there has been really steered towards the acute organisations. So the development of the portal actually is ongoing and is improving. We're aiming to get it live in our mental health teams over the next couple of weeks. There's technical difficulties with the candidates of how we do that. But actually the focus of ICS is mainly on acute hospitals rather than being on the other trusts. So the push is to make sure that we continue to have voice and we continue to push that element. We've also been working really hard with the virtual board team, making sure we really use digital part of the virtual board team and we've got some visits with Kate Pike and other organisations to see how they're doing that. We can make sure that we're all on those. So it is an area that we've done an awful lot on in terms of different projects, but it's something that is on the radar that we will be continuing to look at.
Okay, thank you. And just to find out whether this is Natalie or yours, Lisa. I've had the diary in and out, currently out. I've never yet seen the EPA. I think I've requested on occasion, not happened. Somebody please the regulation and get so I can have a look at it because we all talk about it. I've had that point, they then just disappear. Now I understand. I think it's just one more since COVID break. So I get all that. If somebody can pick that up, I'd be grateful. Thank you very much. Okay, if we can that and good work, Lisa, there. It's one of those real enablers for our teams to do what we need to do. So keep fingers on the roll for that one and keep it transferring. So thank you and the team for I know a lot of praise for. I think we can connect at that board level as well. Okay, we can move on to the next report. Jill, managing confidence in the NHS.
Yes, this is a report that we're required to present annually to Trust Board, although we often do a lot of the more detailed work at Audit Committee where I present a full report about all of the declarations of the not only board but the highest paid change staff and doctors and dentists. I can apologise on the report note I've got Carol's and Lisa's titles slightly incorrect and I'll obviously update those so we've got them correct on the website. The managing conflicts of interest policy was brought on nationally some 6 years ago now, and it's fair to say that there's been different approaches adopted across different trusts as to how far down the organisation positive declarations are sought. We've had the discussion at the board committee and that's where we determined the levels that we would seek positive declarations, although we ask all new starters to make a declaration and we periodically have a push in terms of raising awareness of the policy. but from just in terms of the decision-making staff, obviously, as part of fit and proper checks, all board members are required to make declarations, and just for information, your annual fit and proper declarations will be submitted to you at February Trust Board when we're all together, and also we have the all agenda for change staff who are band 8D and above, and doctors and dentists or consultants. I'm happy to take any questions on the content of the report or any of the declarations that are mentioned there.
Thank you, Jill. Does anybody have any questions at all or any points of clarification? I'm sure Jill will pick up anything outside of the meeting. So it's one of those things, if we don't need to talk about it, it's great. But the moment you do have to talk about it, it could be big trouble. So I know Jill keeps a close eye on this, and we all need to personally as well. Okay, if we can note that report, thank you very much, which then moves us to item 24 on our agenda. Is there anything we need to say about those two documents, Jill? The lease Worcester City Inpatient Unit or the Hadley Wider Works 136 suite? Just there for information. There have been no, so number 25 takes, there have been no AACs, which is always a disappointment because I always like to see that we've recruited some consultants, but not on this occasion. Number 26, is there anything that we've heard today that we think, or seen or read in reports, that we think needs to be escalated to either a different level within the risk register or put on the BAF? Anything come to anybody's mind? Clearly there's an emerging continual risk that's always there around finance for the next year. Robert always says to me when I meet him, yes, we're okay this year, Mark, but next year is the one we need to look out for. And I think with what we know is coming over the hill, that's equally true. That's already captured, but we need to make sure it's captured properly as the difficulties emerge, as I'm sure they will do from the moment Robert receives actually the national allocations. Nothing else from anybody? Okay, thank you very much. Nothing on there. There is a little bit of any other business, which is something that came up only in the last couple of weeks, which is why I've accepted it as any other business. Robert.
Yes, thank you, Mark, and apologies. Actually, this came up on Monday, so it really was very late. It links to an item in Sarah's Chief Exec report, actually, which is around national strategy for trying to leverage greater buying power for the NHS, and we've received guidance earlier this week that the first area that they're seeking to do that is around energy. So there is now a move to have centralised national procurement for energy. The reason I'm bringing this here today is just early warning. We're going to be required to make a decision as a board by the 9th of February around a proposal for the NHS nationally to centralise procurement through Crown Commercial Services. So I know I will need to provide something to board members outside of this. Clearly, given the nature of it, it'll be commercial in confidence, but this was just advance warning that that's something we will need to do. So that was it, Mark, really just warning for board, and obviously something we can put in the record of the meeting that we're having to do that outside of normal governance.
Okay, thank you, Robert, and you'll keep us informed, obviously. Okay, that brings us to conclusion of today's meeting. The next meeting will be 21st of March. We've now got a decision board. We're due to come together for our board development session and session in private. We were due to start at 1 o'clock. We can either start at 12:30, or we can switch to our private meeting now and keep going till 1 o'clock and knock off some of the items